Hey everybody, how's it going? I hope you're having a lovely day. To my left is Mr. Clinton the cat. Say hello, Mr. Clinton. You gotta do a better hello than that if you want a greenie boy. Give me a real hello. Give me a Clinton hello. Good boy. Okay, you get a greenie later. Good boy. So this article is on Hamilton and several other Broadway shows closing in New York City. I want to discuss why I find this troubling for reasons past what you actually read in the article. This says over here, Hamilton cancels additional Broadway performances due to COVID-19. The Broadway production of Hamilton canceled its December 16th and 17th performances due to breakthrough COVID-19 cases within the company, the production said Thursday. The production had initially canceled its December 15th evening show due to the discovery of positive test results. The statement from producers does not specify a return date for the production. Ticket holders for canceled performances will be refunded at their point of purchase. Multiple Broadway shows are facing cancellation due to breakthrough COVID-19 cases. Mrs. Doubtfire, Freestyle Love Supreme, Tina, Ain't Too Proud, Harry Potter and the Cursed Child were forced to cancel performances this week after cast and crew members tested positive for the virus. Broadway cast and companies are required to be fully vaccinated against COVID-19. Now, why is this worrisome and what bothers me about the article? The first thing, I want to know more than, quote, tested positive. I need to understand more to understand what's going on. And this is the complaint that I had about how a lot of the COVID coverage is going, whether it's Bloomberg, New York Times, CNN, or anything else. And I talked about that in this video I did a few days ago, more COVID front page news. In this article, what bothers me is this paragraph. This is an unrelated article, by the way. It says Mark Rosenberg, 33, attended an LCD Sound System concert on Saturday with a group of about 15 friends who were fully vaccinated. As of Thursday morning, 8 tested positive for COVID, including himself, who got a booster before Thanksgiving. I'm going to say something very radical here. Let's see if I get to keep my channel. I don't particularly care if a young individual who has been fully vaccinated and has a booster tests positive for COVID. I care about the circumstances under which this happened. If somebody is supposed to go to work and they realize that they are coughing up their lung and they feel like they are about to die, so they go to the doctor and they get tested positive, that is different than somebody who is going about their day, doesn't even notice anything different about themselves, is required to get a test once a week for work and test positive and goes, oh, wow, imagine that, I'm positive for COVID. Didn't even notice. That's important information, and I find that this information is missing every single time I hear Omicron discussed with new cases. I don't care if I get COVID at this point. If I have, again, I'm vaccinated, I got it last year, I'm young, I lift weights, I do cardio, I eat well, I keep in shape. I don't care if I get COVID. What I care about is getting COVID to the extent that it fucks up my life. If I get COVID, and because I'm vaccinated, because I'm healthy, because I got COVID last year and beat it, I have a case that is so mild that I barely notice it, I will go on with my life. If I get COVID to the point where I am coughing up a lung on my kitchen floor and I can't walk up the 4 flights of stairs to get to my apartment, that's very, very different. And it's necessary to be able to make decisions about risk assessment. Here, I want to know how this went. It's important to understand how this went. Do you have a case where you have somebody who is practicing in their dressing room, they're practicing, they're rehearsing into the mirror, and then they start coughing up a lung, they feel like they are about to die, and they get a test and they're positive? Or is it a case of they're practicing, they're doing everything they're normally doing, they're dancing, they're singing, they're rehearsing, and then they get their mandatory test the day before, and it's like, oh wow, I was positive? I didn't even know that. This is an important piece of information, and it is not something that I see reported anytime you see any reports about Broadway. And this is very concerning to me, because you do have to keep in mind the context. We are talking about an audience that is required to be 100% fully vaccinated by law. They are actually checking it. Again, when you go to a Broadway show, this is not like walking into a deli that has a chair. This is not like walking into a small restaurant or bodega where they say, do you have your vaccine card? And I go, yeah, and I go to do this. And like, oh, never mind. They actually care. In Broadway, they will check your ID. They will check your vaccination card. They make sure the names match. They make sure you're not messing around. And Oreo, you got to stop doing that. I'm in the middle of a video. I just fed you, and the more you cry while I'm working, the less I am going to feed you later. You are a 13-pound cat, Oreo. Enough is enough. You got a can literally 20 minutes before I started this video. No more food. We are talking about an industry where every performer is required to be fully vaccinated. Every cast member is required to be fully vaccinated. Every audience member is required to be fully vaccinated. And the audience, after being proven to be fully vaccinated, are required to wear masks inside of the theater. And a positive test among one or two of the cast members or crew is enough for the entire show to be canceled. Again, we don't get to learn, okay, if this person got COVID, are we canceling the show because they feel bad and cannot perform and don't have a stunt double? Are we canceling because the stunt double or whatever also got COVID to the point where they are not able to perform? Are we just doing this out of a, quote, large abundance of caution? Because if it's the third one, then that scares me. The reason it scares me is because it means that we do not have a path back to normal life as it is. If we continue as we are, there is no path back to normal. Here's why. If you could still spread and get COVID while being vaccinated, and you require vaccinations of everybody that enters the show, what else more can you do at that point? Again, you've required a vaccination of your audience, you've required a vaccination of your cast, and you are requiring proof before anybody enters the building that they have all of this. So if we are at a point where the risk tolerance in our society is such that one positive test is enough to cancel a show that's going to make hundreds of thousands of dollars, that has thousands of people in the audience, if one positive test of COVID amongst an audience of fully vaccinated people is enough to say we are canceling everything, how do you move forward as a society at that point? How does that work? What do you do? Again, if we were talking about, pre-vaccination or before we had... Oreo, you are not getting food. Shut up. He literally had 2 cans today. This cat, he barely has a neck anymore. Like my manager, Steve, has a cat named Phoebe. And Phoebe doesn't have a neck anymore because, he and Viniera feed the cat every time the cat makes this noise. I want Oreo to still have some remains of a neck. So I am not going to feed him his 3rd can early afternoon. No way in hell. Keep crying, Oreo. It's not happening. Cry more. QQ, mofo. If we're at a point where a fully vaccinated audience and a fully vaccinated cast are still going to say, when we have one positive test, let us cancel a show that people may have traveled for, hundreds or thousands of miles throughout the country and paid, hundreds of thousands of dollars for, then we're screwed. Who is going to buy a ticket to a show? Who is going to book a vacation to New York City to see a show if they know that one case being positive if one positive case is enough that it renders the entire reason that they came here useless? Because as Eli, the computer guy, has said, again, I don't vacation to New York City. I live here. Unfortunately, I live here. But other people, like him, when he lived in Asheville or when he lived in Baltimore, he would actually plan his vacation around a Broadway show. He'd have a Broadway show, and the hotel he stayed at, the restaurants he stayed at, the dates, all that would be planned around the show. If the show is canceled, then he doesn't show up. And there's who is actually going to plan a vacation, plan their careers, or plan their lives around this? What actors and actresses in Broadway shows are going to plan a career around the idea that if one person among hundreds of people tests positive, that we are going to cancel everything? If we were talking about smallpox pre-vaccination, I would be running for the hills and I'd be living inside of a cave. But we're not. We're talking about COVID in a post-vaccination world. And the more important question here is, what is the route out? At what point will we be satisfied with being able to have a show without these types of cancellations? Is it when we come up with a vaccine that prevents transmission and spread? Is it when we have a pill that magically just kills COVID and destroys it? Is it when we get to zero COVID, where there are no cases anywhere amongst anybody all over the world? Is it when we accept the risk tolerance that Cuomo set last year when he said, quote, if it saves even one life, was ridiculous and not a way to plan your society? What bothered me so much about Andrew Cuomo in 2020 was not that he got out there and he said, I care about public health, because that makes sense. It wasn't when he said, we care about managing this crisis properly. That makes sense. It wasn't when he said, we care about human life. That makes sense. It's when he got out there and set the bar at a ridiculous point, and he just pretended that the last several thousand years of our society were based on something that it was not. When he said, and I quote, if it saves even one life, when referring to saving a life from COVID at the expense of all of the restrictions that he put in place that damaged the economy, which again is not just there to deliver mansions and, luxury vehicles and, $30,000 computers, but is also responsible for delivering medicine and everything else. When he is talking about damaging people's physical health, when they're not allowed to, be around each other in parks anymore and go jogging and running, when you're not allowed to use the gym anymore because he closed them all, when you lose your job, when you have this level level of anxiety that you have because the economy is getting destroyed around you. Your sense of purpose is being destroyed around you. Let's ignore all of that. Quote, if it saves even one life from COVID, because that is unsustainable. I think it is important to preface what I'm about to say by saying that COVID is far more dangerous than the flu. By far, over 10 times more dangerous than the flu, over 10 times as many deaths, way worse. That being said, if you have about 15,000 people a year or so in a certain area that die of the flu, and you've set the bar at, quote, if it saves even one life, doesn't matter if we're talking about 15 to 30,000 people dying or 300,000 people dying, because both of those numbers are over one. We have never structured our society around changing everything, radically destroying and shifting everything to try and save, quote, one life from one particular illness or disease. And the problem here is that we now are looking at the effects of that. We now have to figure out how to claw our way back from that. We are at a point where if there is one positive test among a restaurant where every patron is forced to be vaccinated and every staff member must be vaccinated, they close the restaurant. How do you go back to a normal society when you have set the standard to such an extent? Again, if the standard were set to, let's do everything in our power to prevent death and misery from this illness without destroying our way of life, that's something that we could all work towards together. And we probably wouldn't have the extent of culture wars that we have around the country right now. When you go out there and you demagogue and say, quote, if it saves even one life, we will destroy as much as humanly possible in the pursuit of this one univariate goal, less COVID cases. Doesn't matter if your audience is fully vaccinated. Doesn't matter if your cast is fully vaccinated. Doesn't matter if your patrons are fully vaccinated. Doesn't matter if your restaurant staff is fully vaccinated. None of this matters. Shut it all down if there is one case. And this does beg the question of how are we making our decisions? Are we making our decisions based on a desire for zero COVID? Are we making our decisions based on a desire to just lower the cases as much as humanly possible whenever possible at the expense of the industry, the economy, people's lives? Or are we only going to shut things down? Are we only going to have closures when the people are not able to do their jobs because they are too sick to do so, and the people who would sub in for them are too sick to do so? The reason I ask this is because we all need to collectively know how decisions are being made so that we can make decisions in our own lives. We need to be able to make decisions, not just based on, where are we going to go on vacation or something like that? What industries are we going to work in? What states are we going to live in? How are we going to live our lives? We need to know that. We need to not simply understand what the underlying data is. Our cases going up and down, our hospitalizations going up and down, but rather, how are you making your decisions? What is your end goal? Is your end goal that we be as healthy as humanly possible while maintaining our way of life with these systems and structures that are in place? Or is your goal zero COVID regardless of the consequences? Because the former versus the latter are going to cause us to make radically different decisions regardless of what the case numbers are. Even if the case numbers for 2 weeks were zero throughout Broadway, I would not want to go into the industry working in Broadway. I would not want to build a career around Broadway if I knew that one positive case amongst a fully vaccinated industry means that we shut everything down. However, if I know that your goal is a different goal, if your goal is simply to have us be as safe as humanly possible with the technology that we have, vaccines, treatments, and everything else, and you mandate vaccinations among the audience, the staff, everybody else, if your goal is to keep everybody as healthy as humanly possible while maintaining our way of life, and one person gets sick, you don't shut down the entire show as long as somebody who is able to cover for that person's position or sub in for them is able to perform. Then even if I see cases doing this, I may decide that I'm going to ride it out. I may ride it out and decide that I'm going to continue working for this production company, even if we're going to have a hard month or so, because I know that our goal is a goal that is actually reasonable. It is something that we can reach. However, if I know that you are basing your decision-making processes on what I believe to be an impossible to achieve goal that I discussed prior, then I may say, fuck it, I give up. I'm going to become a coder. I am going to move to a different state. I'm going to move to a different industry. I'm going to become a Twitch streamer or do something else. But it is imperative that you understand the decision-making process, not just the data that they're basing the decision on, but the goal they are looking to reach with the data that they receive so that you know how to live your own life. And I think that a lot of the anxiety that you are seeing in other people, I think the reason that you are seeing individuals that work in this industry that will show up on my stream last night and say, this is actually affecting my mental health, is stemming from the fact that they have no idea what the stated goals are of the individuals making the decisions. There's something that's bothered me throughout this pandemic, and it was very difficult for me to pinpoint why it bothered me. It's when I hear a politician or a policymaker say something along the lines of this, quote, "We're making our decisions based on the data." At first I thought, in a really knee-jerk way, wow, maybe I am anti-science. Maybe I'm anti-data. Maybe I'm living in my own bubble, in my own world, based on my own biases, my own temperament, and my own ideology, rather than reality. But that's not the case at all. The more I journaled, the more I realized that that answer is actually not an answer at all. The reason this answer bothers me so much is because the politician or the policymaker will pretend it's an answer when it's actually one of the biggest non-answers in the world, because it doesn't tell me at all what you will do with different pieces of data. If the data is here versus here, what will you do versus what that person will do? I care about this because it leads a sense of stability and ability to understand how to make decisions with my own life. When I hear a politician at this point say, or somebody that runs a company say, quote, "We make our decision based on data," I translate that in my head to mean I have no idea what to expect from you. I have no idea what your values are. I have no idea what your goals are, so I cannot trust any sense of stability from you. Let me try to give you an analogy here. Let's say that I say, until I am in better shape, I am no longer going to make YouTube videos. I am no longer going to play video games. I'm not going to watch TV, right? And then you ask me, okay, so how are you going to make the decision on when you're going to go back to making videos and playing video games? And I say, I'm going to make it, quote, based on data. Have I actually answered your question? Have I answered your question at all? No, because I haven't told you my goal. Data is not a decision. Making decisions based on data is not a decision. It is not a goal. It tells you nothing. Maybe my goal is that I be able to run a mile in 7 minutes. Maybe my goal is that I can do one pull-up. Maybe my goal is that I can run a mile in 3.5 minutes. If my goal is that I run a mile in 7 minutes and be able to do one pull-up, I'll be playing video games and doing videos again very soon. If my goal is running a mile in 3.5 minutes, you know you should unsubscribe from my channel, because that means I'm never making a video again. You can make different decisions based on having a different goal, a different mindset, a different philosophy with the exact same set of data. Two different groups can make entirely different decisions based on the same set of data if they have different goals and different values. So it's very important that I understand more than this really non-answer, this weaselly non-answer of we make decisions, quote, based on data. I need to know, what are your goals based on the data? I need to know, what is your philosophy? What are your values? How do you see the world, so that I know what type of decisions you're likely to make if data does this versus that. For me, I could explain to you what my plan was last year. Before we had any idea what this was, I was not willing to shut down my business, but I was willing to take every single precaution I could while staying open. We had universal masks in the store. Back when you turned on the television, they were saying that masks were for hypochondriacs. Many people criticize us for following a government mask mandate. There was no government mask mandate when we had masks on in the store. We got masks because it just made sense to do. If we are going to have $20,000 per week in payroll, if we have zero income, if everybody gets sick from a virus we don't really have any details on yet, we're out of business. If I'm wrong, okay, we had mild discomfort for a while wearing masks, and I wasted $3 a day on them, and we all look stupid in our pictures that we look at for 2020. If I am wrong and we don't wear masks, I spend $20,000 a week on payroll with no income, I go bankrupt, and we are all fucked. There's a book by Thomas Sowell. It's called Discrimination and Disparities. And the first chapter actually doesn't have much to do with race at all, but it was my favorite chapter in the book because he talks about decision-making. How people make their decisions is often based not on whether or not they think they're right, but rather the cost of being wrong. We took the masks off in June of this year after the CDC said if you are fully vaccinated, you can take off the mask indoors, because at that point we figured, okay, this is as far along as we're going to get. We are 85% vaccinated here. We are a staff of young people with no comorbidities, no pre-existing conditions. The government was mostly concerned about hospital capacity and hospitals being overrun. We gave them a year and a half and over $5 trillion of money printing to figure out how to get more hospitals. If they wanted to use the Army Corps of Engineers to build hospitals in many of the empty buildings and empty space in New York City, they could have done that. If they wanted to use any of that $5 trillion that just got spit into the economy over the past year and a half to say, hey, did you retire from working at a hospital? Here is the time to serve your country. We will pay you double what you were making prior to retirement if you return. Be a patriot. Uncle Sam needs you. We had a year and a half to build up medical capacity. My store was 85% plus vaccinated, now 100% vaccinated. So at that point, I figured, okay, if we don't take the masks off now, we're never going to do it. If we didn't start building the increased medical capacity over the last year and a half, we're never going to do it. If these vaccines that, again, all of these companies have put billions of dollars into developing do not work with all the modern technology that we have now, then we're probably never going to figure it out. Since none of us at the store wanted to deal with, again, wearing this until the end of time, we decided to draw our line in the sand in June, and that's when we took them off. We had them on for this reason. We had them off for this reason. But the goal was very specific. It was a goal that everybody knew. They understood my decision-making process at the time because I actually shared it with them. I'm not at a point with my business where if one person tests positive at the store that I'm telling everybody, okay, nobody is allowed to come to work, whether you're a customer, employee, or anything. If somebody feels like staying home because they feel uncomfortable, by all means, I've always had an unlimited sick day policy at this company, and I'll likely continue to have it until the day that I go bankrupt. I trust my employees. I believe that they are adults, and if they want to take a sick day, they take a sick day. That's the way it is. However, I do not have a company-wide policy where if one person tests positive, the entire staff goes home. At this point, we are up to a 100% vaccination rate. What I care about at that point is weighing the risk versus reward. If one person tests positive in my staff, I'm going to tell them to take a test, stay the fuck home until they're better. But I'm not going to tell the entire staff, we're not working anymore. I'm not going to tell the customers, sorry, you can't come in and pick up your stuff until next year. We're waiting until there's zero COVID. I don't see how you run a society like this. I think the only thing that you have to do is accept that the risk tolerance that was created last year, that whole if it saves even one life, is something that is not sustainable for society. I think that large swaths of people are going to have to back away from that and admit that in some way that was wrong. I've been wrong about many things. I'm open to admitting when I'm wrong about those things. Some of the best viewed videos in this channel have the title edited to say I was wrong about this, watch this other video. I have no problem admitting when I'm wrong. I have no problems. Again, I may disagree with people on a lot of stuff, but when I realize that I've made a bad decision, I will tell you. And I think that at some point, we are going to have to really think about what we want society to look like over the next 2 to 5 to 10 years. Because either we have a society where we just get rid of this stuff altogether, where we don't have Broadway shows, where we don't have restaurants, where we don't have all this stuff, or we figure out a realistic risk tolerance and a realistic goal. If our goal is always going to be some vague, let's just act out of an abundance of caution to protect as many people as humanly possible, I don't see how we go forward there. I don't see how we ever return to having restaurants, Broadway shows, people working in an office, or anything else. Again, if a 100% vaccination rate among the cast and the audience is not enough, what is? And I really would like to know an answer to the question in the beginning. As I said, these individuals that tested positive, are we talking about people that could no longer sing, that could no longer dance, that felt physically disgustingly ill, where all of them feel ill? Or are we talking about, I'm getting my mandatory test. Oh, I didn't even notice I had COVID. Wow, I tested positive? That's surprising. I think that's really important information, and it frustrates me that it is left out of all of the coverage, whether it is Bloomberg, whether it is New York Times, whether it is CNN, whether it is even these Broadway news sites. When I read something like this, where somebody says, I am young, I am fully vaccinated, I attended a concert, and I got COVID. What was it like? Because again, I don't care if a healthy 33-year-old man gets the sniffles. I don't care if a healthy 33-year-old man has a positive case but does not notice that they are positive and is surrounding themselves with people who are fully vaccinated and wearing masks. What I care about is the actual effect that it has on them. Oreo's sucking up to me. He wants food so bad. He's not getting it, though. Like, look at how fat he is. Look at this guy. Look at you. You're a chunk of lard. And you always want more food. It's not happening. No. Mr. Clinton is not asking for food. BlackBerry is not asking for food. But you are asking for food. Why is it always you? Why is it always you, Oreo? Why are you always the one that's crying for food? When Clinton is okay without more food, and BlackBerry is okay without more food, and I'm okay without more food, but you want more food. Why? He's so cute. He's so cute. He's my kitty. I love my kitty. I love my kitty very much. My kitty makes me happy. My kitty loves me. My kitty is very loyal to me. He keeps me company. He comes over to me and gives me head rubs and nuzzles when I'm feeling bad or stupid or anxious. He's such a good little boy. Even if he's a fat boy. He is a fat boy, too. Anyway, I'll see you all in the next video. Let me know what you think in the comments down below.